Okay, this report is for Stan Checketts. He is a 52-year-old male. He's full cold, allergic to Demerol seen by a skin rash. He was admitted today to the ED complaining of a severe abdominal pain and nausea vomiting over the past 2 days. He has felt dizzy and weak all evening. He was brought to the surgical floor to rule out the preoperative bowel obstruction. He is NPO and not currently on other meds. His medical history: he has had a hernia repair and an appendectomy years ago. He is not a smoker. He's complained of a 4 out of 10 pain that he's had for a few days now in his abdomen, described as stomach cramping and colicky. Vomiting relieves the pain, but any movement makes it worse. His current vital signs are radial pulse of 125 beats per minute, heart rate 117, blood pressure 107/77, respirations 28, SpO2, he's 95% currently on a nasal cannula, and it should be maintained greater than 92%. Temperature is 99 degrees Fahrenheit, and he is alert and oriented ×4. He has ECG monitoring, which shows the patient is sinus tachycardic. His heart sounds are normal, his lung sounds are clear. He has decreased skin turgor and cold skin, and he has a capillary refill more than 8 seconds. And he also has dry mucous membranes. I administered 0.3 milligrams of buprenorphine IV to relieve pain every 6 hours, or PRN. His abdomen is distended and tender. He has hyperactive bowel sounds. He has not eaten or drinking today. An NG tube has been placed, and correct placement was confirmed by the chest x-ray. I administered 4 milligrams of ondansetron to help with nausea, and an abdominal x-ray suggests he has small bowel obstruction. He has not urinated since yesterday. When I was assessing his peripheral IV, there's no redness, pain, swelling, or irritation at the IV site. I gave him a bolus of 500 milliliters normal saline given over 30 minutes, and the IV is patent. Activity has not been ordered specifically, but he is drowsy and dizzy, so assistance may be needed if he is to get out of bed. Some elevated labs were his hematocrit was 60, hemoglobin 20, white blood cell 17, sodium 150, chloride 108, BUN 42, and creatinine 1.9. For Mr. Checketts, I suggest keeping him hydrated and maintaining his IV fluids to prevent hypovolemic shock and further dehydration from vomiting. Also maintain SpO2 over 92% and prepare him for surgery.